Rasbent, naomba tujiandae sasa kuwapokea wageni wetu. Naomba tujiandae. Any moment now, our guests will be coming into the venue. So I've requested the brass band to be upstanding ready for that. Once they will, I will request all of us to also please follow suit by standing up and welcoming our guests. Just also to reconfirm, do we have any medical students in the room? If you're here, please wave if there are any medical students. I'm seeing one hand and a couple of hands up there. Thank you so much. Delighted to have you with us as well on this event. So can I request all of us to please rise? Can we all stand up and let's put our hands together as our guests are coming into the room. Let's clap our hands. May I request you remain standing? Our permanent secretary, can I request you to please remain standing for the national anthem? I will give it a cue as we wait for the rest of the members to take their seats. Brass band.
Ibariki Africa, tubariki Tanzania ibariki, Tanzania tubariki, watoto wa Tanzania.
Let us clap our hands as we take our seats. Katibu Mkuu, karibuni tuketi. May you all kindly take your seats. Niwakaribishe sasa viongozi wetu wa dini mmoja kuikabidhi shughuli yetu kwake Mwenyezi Mungu, tukianza na Sheikh Adam Mwenye Pingu, Sheikh wa wilaya Ilala, akifuatiwa na Biwambi Mkuja Sijabate. Distinguished delegates, we have our religious leaders to lead us on to the opening prayers. Karibuni.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف الأنبياء وإمام المرسلين. اللهم اجعل جمعنا هذا جمعا مرحوما، واجعل تفرقنا بعده معصوما، ولا تدع لنا ولا فينا ولا بيننا شقيا ولا محروما. رضنا بقضائك حتى نعلم أنه لا يصيبنا إلا ما كتبت لنا برحمتك يا أرحم الراحمين. Mwenyezi Mungu muumba mbingu na ardhi na vilivyomo, sisi waja wako dhaifu tuko hapa kwa wakati huu. Kwanza tunakuomba msamaha kwa yote tuliyokukosea, tuliyoyafanya kwa bahati mbaya au kwa maksudi, tuliyoyafanya akiwa madogo au makubwa, tuliyoyafanya mchana au usiku, tukiamini ya kwamba hakuna kuyasamehe makosa hayo isipokuwa wewe ya Rabbal Alamin. Lakini pili, Mwenyezi Mungu tunakushukuru kwa neema zako nyingi ambazo unatuneemesha. Miongoni mwa hizo ni kutufanya sisi kuwa ni sehemu ya wakazi katika kipande chako cha ardhi kinachoitwa Tanzania, kipande ambacho umekibariki kwa mambo mengi sana, ikiwemo amani na utulivu na heshima kwa viongozi wake. Mwenyezi Mungu tunakuomba kikao chetu hichi tunaikabidhi katika mikono yako salama, tukiamini ya kwamba wewe hushindwi na jambo lolote. Tunakuomba tuanze kwa amani, tuendelee kwa amani na tumalize kwa amani. Na kila mmoja aliyefika katika kikao hichi, Mwenyezi Mungu tunakuomba hatua moja aliyoipiga mfutie makosa yake yeye pamoja na wazazi wake, lakini hatua ya pili mnyanyue daraja yake. Mwenyezi Mungu tunakuomba, tupo katika kipindi cha uchaguzi na tunajua nchi yetu ni nchi ya amani na utulivu, basi tunazidi kukuomba Mwenyezi Mungu, dumisha amani na utulivu katika nchi yetu, na wote wanaoitazama kwa jicho baya, Mwenyezi Mungu badili dhamira zao zije katika dhamira za watu wema. Ili kikao hichi tunakuomba zidisha busara na hekima kwa viongozi wetu wa dini na serikali, waendelee kuyasimamia uyapendayo na kuyaridhia. Wa sallallahu ala sayyidina Muhammad wa alihi wa sahbihi wa sallam, walhamdulillahi rabbil alamin.
Tuombe. Mungu wetu, Baba wa rehema, tunasema asante kwa ajili ya zawadi hii ya uzima uliotupa. Tunajua katikati yetu umeweka karama mbalimbali na vibali ambavyo umeviweka kupitia watoto wako. Hata leo hii tunapokutanika kwa ajili ya kusanyiko hili, tunajua liko kusudi ambalo Mungu lilitanguliza kabla yetu. Asante kwa uzima, asante kwa afya, lakini tunaomba uanze pamoja nasi, ratiba zote ukazikabili wewe. Bwana Yesu, tuko katika kipindi hiki ambacho tunaelekea kwa ajili ya uchaguzi. Bariki nchi yetu pamoja na viongozi wote, hata vyote tulivyovipanga kuvifanya mahali hapa vikapate kibali chako, kama ambavyo ilielekeza kwenye kitabu chako cha Zaburi 133 mstari wa kwanza. Tazama jinsi ilivyo vyema watu wakutane pamoja kwa umoja. Basi umoja huu ukalete tija ili nchi yetu ikapate kuendelea na lile ulilokusudia likapate kutimia. Tunaomba yote kwa imani. Amen.
Niwashukuru sana viongozi wetu wa dini, Sheikh Adam, Sheikh wa wilaya Ilala, lakini Biwambi Mkunja Sijabate, KKKT Dayosisi Mashariki na Pwani, kwa kutuongozea ibada yetu kwa Mwenyezi Mungu. Distinguished guests, ladies and gentlemen, I'm delighted and very honored to recognize the presence of Dr. Saif Shekalage, the Permanent Secretary of the Ministry of Health. Can we all please put our hands together for him? In a very special way, I'm delighted to also recognize the presence of Dr. Salim Slim. He's the Director of Preventive Services, but today is wearing the hat of the Principal Secretary, Ministry of Health, all the way from Zanzibar. Let's also recognize by clapping our hands together for him. I would also like to recognize in a very special way, we are very honored and delighted to have members of the diplomatic community. Allow me to recognize you as per the list that I have. We have Excellency Ambassador Fahad Rashid Al Muraiki of Qatar. Let's clap our hands for him. Thank you so much. We have Excellency Ambassador Thomas Testgen of Germany. Let's clap our hands for him. We have Excellency Ambassador Jasper Hammerskard of Denmark. Let's put our hands together for him. Delighted to have you with us. We have Excellency Ambassador Giuseppe Sean Coppola of Italy. Let's put our hands together for him. But I would also like to recognize the presence of the High Commissioner Randeep Sarai of Canada. Delighted to have the High Commissioner with us. I did not hear us clap our hands. Can you clap our hands for the High Commissioner? But we also have Ambassador Nicola Brenman of Ireland. Let's put our hands together for her. Thank you so much for being with us. We have the U.S. Deputy Chief of Mission, Andrew Lentz. Let's put our hands together for him. Thank you so much. But we also have Chief Chancellor of Poland, the Embassy of Poland. This is none other but Katarzyna Sobieka. Let's put our hands together for the Chief Chancellor. But we also have the Head of Mission from Belgium, Martin de Rouva. Let's put our hands together for him. Delighted and truly thank you for being with us this afternoon. But in a very special way, I would like to recognize the presence of the representative of UN, the United Nations. I'm trying to remember the name of the agency, and is going to give a speech later on, but please, UNFPA with us. Let's give him a big round of applause. I'll introduce him later on as he will come to give us his speech. I would also like to recognize in a very special way the presence of Dr. Chakur Halfani, the chairman of the Board of Tanzania Health Summit, in a very special way. Also recognizing all the members of the Board of Tanzania Health Summit that are present. Thank you so much for being here. In a very special way, I would like to recognize the presence of Dr. Omari Chilo, President of the Tanzania Health Summit. Let's put our hands together for him and our host this morning. And the entire team of Tanzania Health Summit, congratulations for putting this summit and making it a great success. Let's once again recognize the entire Tanzania Health Summit team by clapping our hands for them. All the government representatives present. We have representatives from the President's Office, Regional Administration and Local Governments. We have representatives from the Ministry of Health. Delighted to have you. Thank you so much. You will all be introduced shortly. But we also have can I also recognize the presence of all the regional medical officers present, all the RMOs, if you can all please rise. RMOs, DMOs, thank you so much for being with us. I would also like to recognize all the medical officers in charge present. Karibuni sana. We have global health specialists, we have pharmacists, we have nurses, lab scientists, we have distinguished speakers who momentarily will come and sit on a panel to dissect the theme for this year, which I'll also mention shortly. We have the chief executive officers from different institutions that are present, managing directors, we have human resources managers present, general secretaries. But we are also delighted, Permanent Secretary, to note that we have leaders from professional associations. These are MAT, MAT, PST, TANA, MELSAT, and all other professional medical associations, that are present. We also have medical students with us, invited guests, members of the press, ladies and gentlemen. Jamhuri ya Muungano wa Tanzania. Okay. So I'm not sure if this is the summit for the doctors or for the patients. Jamhuri ya Muungano wa Tanzania. Thank you so much. Distinguished delegates, ladies and gentlemen, this is the 12th Tanzania Health Summit, which deserves a big round of applause. Can we all put our hands together for this summit? We are guided by the theme, harnessing data utilization and technologies to accelerate universal health coverage. Without further ado, once again, I would like to commend and truly thank all the sponsors. Can we once again put our hands to all the sponsors who made this summit a great success? Number tuwapigie makofi all our sponsors and the organizing committee. Distinguished guests, ladies and gentlemen, without further ado, may I be allowed to invite to the podium the board chairman of the Tanzania Health Summit, Dr. Chakuu Halfani, to give us the welcoming remarks. As he comes, let's usher him with a round of applause. Karibu sana, Dr. Chakuu. His remarks will be followed by the key objective as to why we've gathered here this afternoon. Karibu sana. This remark will be given by Dr. Chilo, the president of THS. Karibu.
Good afternoon. Why is not loud? You are tired. Good afternoon. Assalamu alaikum. Bwana Yesu asifiwe. Our special guest, Dr. Saif Shekelage, protocol observed. I'm standing before you this afternoon just to give a short welcome remarks. And most of the work that is supposed to be done is already summarized by our master of ceremony. Therefore, my work is very easy and I will try my level best to use a short time as possible. First of all, I would like to take this opportunity to welcome everyone to the summit. As we have said, this is a 12th summit. It has been a long journey. And all of you have been with us all those times, ups and downs. Welcome very much to the most, I think, advanced summit or the previous summit that we have seen. Welcome. However, I would love to recognize very few as much as possible. I wish to recognize everyone, but because of time, I will recognize only few people. First, sorry, can I have program book? I would love to recognize our sponsors, because without them, we could not do this summit. Therefore, allow me to use the shortest time possible to mention our sponsors, and please, wherever you are, you can even raise up your hands. Before sponsors, we have our strategic partners, World Health Organization. Anyone from World Health Organizations? You can see it from your book. And also we have our platinum sponsors, TMHS. Can raise up your hands. Also we have our forum sponsors. If you look at your program book, you can see many. Therefore I wish to mention all of them, but because of time I may not mention. You can look at your book or forum sponsors. I would like to thank you very much for your time. And also, I would like to thank you, our participating institutions If you look at your program book, we have a participating institution there. Please, thank you very much, and we really appreciate you. You can wave your hands like this, participating institution representatives. I see some hands there. Thank you very much. We also have exhibitors. When you open your program book, you can see a list of exhibitors there. We have around 56 to 59 exhibitors. Please, raise up your hands. Thank you very much, our exhibitors. And then we have our advocacy partners, MAT, representative from MAT, M-A-R-T-I. Raise up your hands. Thank you very much. We also have our hotel partners, Onomo. Also, we have our media branding partners, which the list there you can see by yourself. From sponsors, exhibitors, and others, we have our delegates. As you can see, the room is packed. Without the delegates, this room could not be packed. Therefore, their presence makes this summit wonderful. We have a group of participants, or delegates. We have people from NGOs, non-government organizations, and CSOs. Can you raise up your hands, please? People from NGOs. Thank you very much. And then we have people from public institutions, from district hospitals, from ministries. Thank you very much, and we take this time to thank you and welcome you. We have our speakers and presenters. As you have seen, we have more than 100 speakers. Thank you very much, and you are welcome. We have our donors and development partners. Thank you very much. We also have our organizing committee. All members of organizing committee, can you stand up briefly, please, so that we can see you? Thank you very much. Our engineer in Sianda, I can see her there. Thank you very much. We also have volunteers. All the volunteers, can you please stand up? We have more than 70 volunteers. Thank you very much. Also, I would like to mention, and please stand so that the team can see you. We have members of the board who are here. We have members of the board who are here. As you can see among the first pages, page number 4, you can see board members. But we have a few of our colleagues who are here. Dr. Samuel Ogilo, you can stand and wave your hands, please. He's there. He's the chief of AFTA, CEO of AFTA. We have Dr. Thompson, Anna. He's member of our board. Thank you to have here. We have Dr. Jeremy, all the way from Burkina Faso. He's here. He's a member of the board. The rest of members of the board are not here with some apologies. Most of the people that I wish to recognize, they have already mentioned by a master of ceremony. However, I would like to mention a few who are with us here. The first is our permanent secretary, Dr. Saif Sheklagi. Welcome very much, and we appreciate your presence here. You have taken all the time to move around the booth, and everyone is happy. Thank you very much for your time and commitment. We have also Dr. Makwani, who is the director at the Ministry of Health. Dr. Makwani, thank you very much. We really appreciate your presence. We have Director of Information, Communication and Technology, Ministry of Health, Mr. Silvanus Ilomo. Thank you very much. We really appreciate your presence. We have Director of Curative Services. We know him very much, Dr. Vivian Wonanji. Dr. Wonanji, where are you? He's there. Thank you very much. We really appreciate your presence. From Pure Rush, we have our Director of Health, Social Welfare and Nutrition Services, Dr. Mfaume. Thank you very much. We really appreciate your presence. We have our Director of ICT, Mr. Eric Kitali. He's the Director of ICT. Thank you very much. We appreciate your presence. From our Ministry Zanzibar, we have Director of Preventive Services, Dr. Salimu, who has been very active at the summit. Please stand up so that people can see you. Thank you very much. We have also Director of Planning, Policy and Research, Mr. Abdulatif Hatib Haj. Thank you very much. We really appreciate your presence. We have also people from our stakeholders. As I said, I will to mention everyone, but because of time I may not be capable of doing that. However, I would like to mention a few people. DPG representative, Mr. Mark Bryan. Thank you very much. We really appreciate your presence here. We have Director of Eastern Africa Regional Coordination Center, CDC, Dr. Mazaba. We really appreciate your presence here. We have Chief Clinical Officer of Health Services in Ireland, Dr. Com Henry. Dr. Com Henry, thank you. We really appreciate it. We have also Director of NHF, our funding organization or funding institution, Dr. Irene Isaka. Dr. Irene, thank you very much. We are also a Health Manager from UNICEF, Ulrika Becker. If I mention the name very correctly, thank you very much. We also have Senior Health Economist from World Bank, Dr. Mustafa Abdallah. Dr. Mustafa Abdallah, thank you very much. We really appreciate your presence. We have a Country Director from Jepaigo, Alice. We recognize your presence. Thank you very much. We have a Country Director, Care Prudence Masako. She has been active with us all the years of the summit. Thank you. I really appreciate your presence. We have a CEO of Sanku, Felix Brooks. CEO of Sanku. Thank you very much. We have Country Director of AMREF, Dr. Florence Tem. She has been with us all the years. Thank you very much. Where is Dr. Florence? We also have Country Director of Maria Stops, Mr. Patrick Kinemo, our own brother, who has been there as well always. We have Country Doctor of Farm Access, Dr. Henry Marwa, who has been very supportive and always with us. We recognize the presence of March President, Dr. Mugisha. Dr. Mugisha, thank you very much. We appreciate your presence. We have also President of PST, Mr. Fadiri. Mr. Fadiri. We have currently Director of SolidaMed, Dr. Sambiri. We also have Ambassador and Commissioner who has always been mentioned, except a representative from Swiss Embassy, Francisca. I think the rest has been mentioned. Thank you very much. We appreciate your presence. We also have our judges who are going to judge our abstract. The Chief Judge, Dr. Professor Seni. Chief Judge, Professor Seni. We also have Professor Elizabeth, all the way from Germany. She is here with us. Where is Professor Elizabeth? Thank you very much. We also have Professor, my teacher, Professor Liamuya, and the rest of the team. We really appreciate your presence and thank you very much. Last but not least, I would like to recognize the support we are getting from the Tanzanian government. As you all know, this could not be successful without support from Tanzanian government. And we appreciate Excellency Dr. Samia Suluhu Hassan for the support we have been receiving for these 5 years that she has been in charge of our country. We have experienced enormous support as far as the summit is concerned. For example, I would like to highlight only 3 aspects. One is participants. Before she came into power, our participant average was around 500. But now our participant average around 1,400. Also, our abstract was around 90 abstracts received, but now our abstract average around 200 we receive abstract per year. And also in terms of international participants, when she came into power, our participant was averaging around 15 to 20 participants per year. But currently we are receiving around 150 international delegates to attend the summit. Also, we have received enormous commitment and support from the government, and to tell you, even from this year, we received the funding from the Ministry of Health. A club fees to Professor Saif, Dr. Saif, and the President for this enormous amount. Therefore, we recognize the support, and we really appreciate the support and the commitment from the government. We understand and really appreciate Tanzania's rapid value and expect more support from the government as the time goes. Last but not least, I would like to appreciate your time, your effort, and your commitment to the summit. I understand we have been through times. We have been through time of COVID. We have been to time of change of leadership. We have been to time of election time, even like this time. But always you have been there for us. Since we have started, we never stopped to have we never missed even a single summit consecutively. This means we are consistent. And we are consistent because of us. We are consistent because of you. Thank you very much, and please always be with us so that we can make healthcare innovations, services improved within our country, within our region, within our continent, and globally. Thank you very much. Please always be with us. I appreciate your presence. Thank you.
Thank you so much, Dr. Chaku, the Chairman of Board of Tanzania Health Summit. Let's put our hands together one more time for Dr. Chaku for great introductory and remarks. Thank you so much, Dr. I'm now honored and delighted in a very special way to welcome our very own Dr. Omar Chilo, the President of Tanzania Health Summit, to give the summary of Tanzania Health Summit 2025 and to welcome our main sponsors' presentation. And then will be followed by a plenary session momentarily. Welcome, Dr. Chilo. Let's put our hands together for Dr. Chilo for the consistency. Karibu sana daktari.
Good evening, everyone. How are you doing so far? Dear special guests, the Permanent Secretary, Dr. Saif Shekalage, representative from Pure Raj, but also we have representing Permanent Secretary from the Ministry of Health, Dr. Salim Slim, dear ambassadors, high commissioners, the chairman of the board of directors, the chair, deputy health, DPs, the ministries, directors, the distinguished partners, delegates, all healthcare stakeholders around here, the youth who have been here since morning, the media, protocol is observed. Welcome to the 12th Tanzania Health Summit. First and foremost, I would like to extend my profound gratitude to our special guests for taking time to be with us this evening. I also welcome all of you as partners and sponsors and all the attendees. You have been supporting us since 2014. Your engagement with us and collaborations for 12 years is basically a cornerstone for this summit success. Today we have a specific theme to discuss and give ourselves tough questions. And the theme is around data utilization and technologies. How do these can be utilized to accelerate universal health coverage? Dear colleague, I know THS, we've been working together for many years, but I want to, before I proceed, I want to have every one of us to have a pause and reflect on the great loss of our dear member, Dr. Faustin Ndungulile, who passed last year in November. Dr. Ndungulile had been elected as an incoming WHO Africa Regional Director. And he participated during Tanzania Summit last year with full engagement. And he shared the insights and encouragement of our effort toward quality healthcare. However, his sudden passing at the age of 55 was a shock, and we are going to miss him, his wisdom as well as his passion. So in honor of Dr. Ndungulile and with his immense contribution to Tanzania Health Summit, let us observe 1 minute of silence in his memory. Thank you very much. May Dr. Ndungulile rest in eternal peace. Dear distinguished delegates, over the years, the discussion at THS have not been merely a talk, but have driven real changes in our healthcare delivery. Our annual themes have addressed pressing challenges and produced actionable results from the stakeholders, but also from the many aspects. So please let us hear from our partners themselves on the screen. Okay, fine. Due to technical reason, I think I should go ahead because of time. So in addition to THS, what have been impacted to different organizations, we also establish few programs so that what is discussed here can also be implemented with ourselves. We have initiated our proudest achievement in youth capacity building, in which we invest in the next generation of health leaders. And this initiative is designed to prepare young professionals with practical skills in leadership, communication, and career development. We have trained more than 270 youth on these areas of leadership, but also skills development in the specific areas. However, in addition to that, Tanzania Summit has partnered with Self-Care to launch a new era of healthcare quality improvement in Tanzania. This program introduces internationally recognized standards and a mentorship approach to help our health facilities elevate their healthcare. However, by adopting these Self-Cares, our facilities in the urban and rural areas are able to identify specific gaps in service delivery and working with them systematically to fix it. Beyond of this, Tanzania Summit is also been supporting different other projects. For example, we have been awarding excellent healthcare workers for the 4 years in a row we have been awarding the best innovation in healthcare, called by Cheer Innovation Awards. But also, we have been working with the communities to make sure that they have better healthcare support through our elcome program. Delegates, over the next 3 years, we will dive into deep in how data and technology can accelerate universal coverage. And what do we aim to achieve at the end of this summit? We plan to formulate an actionable recommendations on integrating data and technology into Tanzanian health strategy to fast-track universal health coverage. Our goal is to compile these insights into a summit that will be shared through our stakeholders, including the ministries. I urge you that every delegate here should leave with new ideas to implement and new contacts to collaborate with. These connections are the lifeblood of Tanzania's summit. Before I leave this podium, and after the video, if it's played, I would invite our friend, Dr. Mohamed Shukuru Musa. He is the Vice President of Ethiopian Healthcare Federation, for 1 minute to talk about the upcoming Healthcare Federation. And after that, we'll have presentation from our key sponsors who are TBHS, and which will be followed by Mary Stops Tanzania. Thank you very much for listening.
Learning a lot from the Healthy Summit in terms
Good afternoon.
of organizing stuff.
Karibu, asante sana. Distinguished guests, honorable ministers, esteemed colleagues, partners, and friends. It's a great honor and pleasure to stand before you today representing East African Healthcare Federation at Tanzanian Health Summit, a platform that unites our voices, our expertise, our commitment to advancing health access in our region. I would like to begin recognizing the visionary leadership of the organizers and the timeless work of all stakeholders. Government, private sector leaders, health professionals, and development partners who continue to strengthen the foundation of health system across Africa. Our region stands at a crossroad, especially Eastern Africa. On one hand, we face persistent challenges, limited access to quality health care in rural and underserved areas, shortage of skilled health professionals, rising cost of medicine and technologies, and the dual burden of communicable and non-communicable disease. On the other hand, we see opportunities, a young dynamic population, rapidly advancing digital health and telemedicine, growing regional cooperation, and the resilience of our people who continue to innovate even in times of adversity. We are gathered here not just to discuss problems, but to share a shared vision, a vision of East Africa, where every citizen has access to affordable, high quality, and dignified health care. To make this vision a reality, I believe we must focus on three priorities. The strengthening health system, we must invest in infrastructure, supply chain, human resource for health, a hospital without a trained staff, or a clinic without medicine is an empty promise. Harnessing innovation and technology, digital health platform, mobile clinics, and data-driven decision-making can bridge the gap that geography and resource have created. East Africa has talent and creativity to lead in this space. Building a regional partnership. No single country can tackle these challenges alone. A cross-border collaboration, sharing knowledge, pooling resources, and harmonizing policies will make us strong together. The private sector has a vital role to play, not as a competitor to public health system, but as a partner. Together with the government and communities, we can develop sustainable health financing models, expanding access to care, and ensure that the innovation research reach those who need them most. At conclusion, ladies and gentlemen, the health of East Africa is the wealth of East Africans. Investing in health is not just a moral obligation. It is the foundation of economic growth, stability, and the future of our children. Let us leave this gathering not only inspired, but committed to action, to collaboration, and to building a healthier East Africa together for the coming generation. Lastly, I will invite all of you to attend our East African Healthcare Federation Summit to be taken in Addis Ababa in the coming May. I thank you very much.
Ladies and gentlemen, another big round of applause to Dr. Mohamed Shakur Musa, all the way from Ethiopia Healthcare Federation. Thank you so much for your remark, as well as for the invitation. The invitation has just been extended for next May. Technical team, if the video is ready, we can play now the first video. Before we officially say that technology has failed us, allow me to bring onto the stage the panelists for the next session. May I start by calling onto the stage Mr. Eric Kitali, the Director of ICT at the Pure Rolls. Let's put our hands together as he comes to the stage. A certified enterprise architect with over 20 years of experience, he's led national rollout of digital system across Tanzania's LGAs. His work has enabled the connection of 26 regions and over 184 LGAs to centralized platforms of health, finance, and education. His focus includes interoperability, public service delivery, and infrastructure scale-up. Once again, let's put our hands together for Mr. Eric Kitali, as I call Mr. Hippolyte Lelo. Mr. Lelo, please join us onto the stage. As he comes, let's put our hands together for him. Mr. Lelo is the Regional Manager for National Health Insurance Fund, NHIF. Previously, he's held the position of Marketing and Customer Service Management, where he was responsible for developing strategies to expand membership, improve client services, and strengthen stakeholders' engagement. With extensive experience in health insurance administration, he brings onto the stage a crucial role in advancing NHIF's mission to increase access to affordable health care for all Tanzanians. Next onto the stage is Professor Pascal. Professor Pascal, please join us onto the stage. As he comes, let's put our hands together for him. For those of us who do not know, Pasco is a consultant nephrologist and associate professor of medicine, currently an associate dean at Aga Khan University, Tanzania, a pioneer in nephrology training and kidney transplant in Tanzania. He has also served as the dean of medicines at MUHAS and director of curative services at the Ministry of Health. He is the president of the Nephrology Society of Tanzania, trustee of AFRAN, and the chair of AFRAN since trustee 2027 Congress Organizing Committee. And finally, onto the stage is Dr. Mustafa. Dr. Mustafa, please join us onto the stage. Dr. Mustafa. As he comes, let's put our hands together for him. Please join us. Dr. Mustafa is a health system expert working with the World Bank. He has specialized in integrating data and technology to strengthen universal health coverage. He brings onto the stage extensive experience in both clinical care and health financing to inform evidence-driven policy and implementation at scale. Distinguished delegates, let's put our hands together for all my panelists as I bring the moderator for this session, none other but our very own Permanent Secretary, Ministry of Health, Dr. Saif Shekalage. As he comes, Karibu Daktari. Mary, can I have the rest of the microphones? As he comes also, would also like to recognize the presence of Dr. Asha, who is promoting and championing medical tourism here in Tanzania, but Ambassador Mark Bryan Shrina, UDPG Health Representative Tanzania, also UN FPA Country Representative. Thank you. We'll hear from you shortly. Karibu Katibu Mkuu, you have the floor. Yes, you can.
Good afternoon, ladies and gentlemen. Welcome to this panel discussion. My name is Dr. Saif Shekalage. I'm Permanent Secretary, Ministry of Health, Tanzania. This panel has been scheduled for 45 minutes if you look at the original program. And you're supposed to start at 15, and we're supposed to end at 16. But we are behind the time. So we'll try to catch up time during this panel discussion so we can save time for the other agendas. The theme for this discussion is harnessing data, utilization, and technology to accelerate universal health coverage. Why we choose this topic and why this theme has been chosen during this summit. We do understand many African countries, including Tanzania, are now in the process to implement universal health coverage, and some of them are already implementing. We do understand the power of the digital innovation, and data-driven solutions are considered as a catalyst for achieving universal health coverage in many of these countries, including our beloved Tanzania. The digital health also offers an opportunity to strengthen health system, and in doing so, it accelerates the progress toward universal health coverage. Digital solutions are the future of equitable, quality health care and the resilient health system. So in this session, the panelists who are here are aiming to highlight the visionary and the practical approaches where digital innovations and digital utilization and technology are transforming universal health coverage strategies. And to prove that, our MC has clearly presented the CVs of each panelist, so no doubt we are going to learn a lot from them because they are the expertise in this area. Some rules, because we want to catch up time. I'll give each one of you a general question just to reflect on what I have given here, a summary, but later on each one of you will have a specific question. I kindly ask you to be brief and straight to the point. And then maybe if time allows, we'll give time to the audience if they have any reactions. So without wasting much time, then we go straight.
Allow me to also invite, there's a missing lady at the center.
Please do.
Apologies are due. Allow me, PS, then the moderator, to also invite onto the stage Miss Orica Baker. Please join us onto the stage. Let's give her a round of applause as she comes onto the stage. I had to designate the centerpiece for you because you play a central role on this panel discussion. Ms. Wendy Erasmus serves as the Chief of Health for the UNICEF in Tanzania, where she leads strategic efforts to improve child and maternal health, strengthen health system, and drive universal access to essential services. Under her leadership at UNICEF Tanzania, she champions programs that focus on immunization, nutrition, maternal health, and building resilient health system in partnerships with the government and the stakeholders. Once again, let's put our hands together for all the panelists. PS, you have the floor.
Thank you. Thank you very much. So I have Eric with me, and Hippolyte, Madame Ulrich, Professor Ugajo, and my brother Mustafa. So you have heard when I was introducing the theme to the audience, and I'll kindly ask you, the focus here is how the digital innovations and data utilization can accelerate the implementation of universal health coverage. So in whatever you are going to answer or give comment, please, that's the focus. Universal health coverage, digital innovations, and data utilization. And to start with, I would like to have a general question to each one of you, starting with Eric. What do you think digital innovations and data-driven solutions are vital in the healthcare with regards to what we are talking now, the universal health coverage? 2 minutes, please.
Oh, 2 minutes. Thank you, moderator and chief of guests. Good afternoon, everyone. This is Eric, and you
can use this one.
You hear me now? Yeah, digitalization vis-a-vis data utilization and accelerating universal health coverage. Before that, before data utilization, we have to start with the prerequisites. And the Ministry of Health, together with the President's Office, we have to ensure all the prerequisites are set. One is e-health strategy. Remember, we had the first one, 2014-2019, and right now, 2019-2024, and right now we have 2025-2030. These are the e-health strategies set up the guidelines, the priorities, resource utilization, and all that to ensure the data utilization is set. And now what we have done, Ministry of Health together with the President's Office responsible for regional administration and local government, we're ensuring we are putting in place the digital public infrastructure. This one includes the e-payment, the registries, the consent management, so that, for instance, the consent management is protecting the data. Digital health and data in health sector is very valuable, so we have to protect. So even the consent management is among the things which we are setting up as the prerequisite. So what we are doing to achieve universal health coverage, from primary health care, community primary health care to tertiary to national, we are putting up systems. And these systems we are ensuring they are interoperable.
30 seconds to sum up, 30 seconds.
30 seconds. We are making sure these systems are interoperable from primary health care to the national hospital. Making the system interoperable, they are ensuring continuum of care. Achieving universal health coverage, you have to ensure continuum of care within the facility and across the facilities, from community to the national, is in place. That you can achieve universal health coverage. You know, I have a lot to speak in 1 hour, but I have been given only 2 minutes, so that is it now.
Thank you very much, Eric. But remember, each one of you, you have the second time, you have a specific question I'm going to ask. So just stick to 2 minutes, and in the next question, we have 3 minutes. Thank you. So, Hippolyte, to you, the same question. 2 minutes.
Thank you. From NHIF, digital innovations and yes, digital innovation is quite important and in achieving universal health coverage in terms of access, creating access to majority. Remember, when we go to universal, now we have 15% of the population covered by insurance. So 85% is out of coverage. So these innovations will need, NHIF will need to figure out how to cover the remaining population using technology. For example, how do we create easy access, the enrollment process, payment of contribution and accessibility of service. Again, in terms of data, it will inform even the government in financing the poor population, especially in the NCDs. Claim payment data can inform the government, because it is when we know that how much it will cost, and so that it will also inform the budgeting process. Greatly, we know now we have to simplify the enrollment mechanism. Currently, instead of using brick and mortar and requiring people to go to the offices, it will not speed the enrollment process. So, as an HIF, we thought using technology can accelerate uptake of members or the citizen to the health insurance. Again, creating of digital products, or using even the aggregators to ensure that we create massive enrollment can be used as an accelerator to universal health coverage. Thank you.
Thank you very much. Madam, did you hear my question?
I did,
Okay,
and
please.
I'm here better late than never.
Thank you.
So thank you so much. And I'm really interested to hear my fellow panelists' remarks. For UNICEF, the digital transformation that we see across all social systems is really one of the main accelerators that we think can transform children's lives, achieve UHC, and also the Sustainable Development Goals. But I think we all know that it's really about what we do with the technology. So I'm happy to hear about that from NHIF. And we need to recognize that these systems, once we've developed them, is not the end game. It's not the solution. And by themselves, we need them, but it's about what we do with them, how we use them, for whom we use them, and where we use them. And we're no longer in an era, I was going to say, where technology is our limitation. We've had some today. But I think a few years ago, creating an app was a major achievement. It's not today. Our children create apps. It's about how we bring the systems together to benefit people.
And I'm really happy to hear Eric talk about interoperability. It's something we've worked on a lot together, but especially when we think about universal health coverage, it's not about the diagnosis, it's not about the siloed services, it's about the person, it's about the people. So how can we make these systems work for people? So I'll have more to say later, but I'll stop there. Thanks.
Thank you very much, Professor Rugayo.
Yeah, thank you so much, moderator, my boss. So universal health coverage is accessing healthcare when you need it, wherever you need it, and without financial hardship. Digital health is a bridge of making sure you get the quality health in the best time in the hospital setting. But outside the hospital, digital health also helps to curate the data, which help us to get the trends and to better develop guidelines and advise policy on areas of need. So I do believe the digital health is a tool that is going to help achieve the universal coverage. Thank you.
Thank you very much. And my brother, the last Mustafa.
Right, thank you so much.
Please.
Yeah, absolutely. Thank you so much, Dr. Saif and panel colleagues here and all colleagues. I mean, it's actually a great pleasure to be here with all of you and think together about the Tanzania health issues and challenges across the board. Now, on this question you asked, Dr. Saif, and maybe I will talk from the World Bank perspective. We always say that digital health systems is the new infrastructure for the UHC. And basically, we cannot afford anymore to have digital health fragmentation. Too many pilots, too many apps, too many platforms. We need to think strategically, and as my colleagues mentioned, we need to make sure that we harness this technology and actually support the government vision as much as possible in an integrated and interoperable way. We need to look at the backbone before applications, the architecture before platforms. And this is maybe based on the lessons learned from other countries. Maybe India National Health Stack is one good example. Estonia X-Road is another example, successful example. But also would like to look at the whole life cycle. We cannot only start a system without having a budget for maintaining and operating the system. We cannot build a road without having a budget for the maintenance and upkeep of this road, but too often on the digital health systems, we build them without enough financing for maintaining them and sustaining them. Last but not least is to look at the user at the end of the day. This is the whole digital health strategy or system or innovation will have to serve the users. The real question today is not whether Tanzania can digitize its health system. It's actually how Tanzania can use the data to drive decisions and the trade-offs and the hard decisions to improve quality of care, to improve equity, and actually to impact the poor and most vulnerable. Thank you.
So thank you, Mustafa. I think I've heard you talking on the World Bank perspective. Now again, on the World Bank perspective, what will the global lessons and financing and the scaling digital health solutions could the Tanzania and the East Africa region adopt to ensure data-driven approaches genuinely accelerate universal health coverage? This again is for you, Mustafa, but again, talking from the World Bank perspective.
Well, thank you so much again, Dr. Saif. And as I mentioned, if the digital health systems or digital health agenda is actually the nervous system of the universal health coverage, the financing is actually the heartbeat. And we need to make sure that we have sustainable financing to ensure those innovations and those systems are in place. Maybe one of the lessons we have learned from other countries is basically to look at the bigger picture and to look at the vision of the government. And this is something that we keep saying, Dr. We have a vision from the government on what services we would like to sustain. And we've seen this in other countries now. Look at what happened over the last several months due to the shifting financing landscape. Too many apps, too many systems collapsed. Why? We didn't have any sustainability plan. We didn't have any funding or ownership from the government. So basically this is very important. Blended financing, innovative financing should actually be the sound of now. Pooling of funds and actually looking at the priorities of the government is one thing that we need also to look at. Maybe one of the things actually we also learned is basically one of the things that we also learned is that the money should follow the data. We've seen other countries in OECD, in Thailand, East Asia, and also Latin America, and even here in Africa, based on the data, purchasers like NHIF and other institutions can make informed decisions where to put the money and how to bring the value, the best value for money based on the data, curb fraud, and also contain the costs. All of these aspects can be achieved with the innovation and with the digital health agenda as much as possible. Last but not least is basically the private sector. We need to focus on the private sector. We need to give opportunities for the private sector, work with them as much as possible. We've seen also examples from Indonesia, what we call total cost of ownership. Basically, it's not build and go. They build and stay, and then they have to transfer. And the government will have to own the systems and run them and own them and also scale based on their capacity and customize accordingly. So I'll stop here. Thank you.
Thank you so much, Mustafa. And now, Professor Rugaju, I know you are coming from an academic institution, Aga Khan. On your opinion, what would be the best contribution for academic institutions that could impact universal health coverage in developing countries?
Thank you so much, moderator. Greetings from Aga Khan, as you said, which Aga Khan University and Aga Khan has services. These are social arms of a wider network, Aga Khan Development Network. We have the ICT department there that has been serving more than 32,000 users in 6 countries, in 7 hospitals. And I'm proud to say yesterday, Aga Khan has services in Dar es Salaam launched the EHR. This is electronic health records that is going to make all the attendees of the hospitals in Dar es Salaam cross-talk, and they don't have to carry any data from one hospital to another. So just now focusing on the question, universities are fountains of knowledge, universities are fountains of intrigue and inquisitiveness, and as you can imagine, all the innovations we use today, almost half of them or more than that were discovered in the universities. So at Aga Khan we have networks and digital health incorporated in our healthcare, in our training, and in our research. For example, in the healthcare we have the EHR, but in the research I will point out 2 examples. One is, for example, we have recently been awarded 1.33 Great Britain pounds million for an app called the Kikohozi app. So this is a technology that is going to use mobile phone. The participants will just have to cough, and then that will be transcribed in a way that it can diagnose separately TB, asthma, and COPD. What will this do? Eventually, when this is validated and getting used, it will be deployed to community health workers who will go all the way to the villages and increase the access to diagnostic facilities for these diseases, which would otherwise take these patients to designated centers to have this diagnosis. But at the same time, we have the Brain and Mind Institute. I'm happy Professor Lukoya is here, who represents He's the Dean of Medical College East Africa, but he's also the Deputy Director of Brain and Mind Institution. They have been using machine learning, but as well as AI to impute data on mobile phones again to predict the suicide ideation and depression among healthcare workers and medical students. So in a nutshell, I would just say through research and through using digital platforms, whether they are mobile phones, whether they are AI-powered, we have a way of increasing access and increasing diagnostic accuracy. That way you will be delivering the care to cut all the distances patients could have followed to designated centers. Yes.
So thank you very much, Ulrich, from the UN family, in particular from UNICEF, taking care, making sure that all mothers and the children are in safe hands. So what do you think the digital innovations and the data can improve the primary health care, especially for women and children in remote area or an underserved area?
So I think there is a huge potential, and we're seeing that potential right now across the country. I think the first thing is, I think we need to shift our minds a bit from this situation where health workers are reporting on their work to someone else, to looking at systems that are actually about documenting the care and making decisions based on the information we document. And there are three systems I'd like to highlight which I think can have a real transformative change for children, digital health systems that exist in Tanzania today. The first is the birth registration for children. There are many in this room who know about this, some of who have funded its rollout. In 2013, a very low proportion of children had been registered at birth, children under 5. It was as low as 12%. And there were only 100 points for registering children across the country. Today, that has gone up tremendously. We're now over 70% with more than 11,000 points of registration. So birth registration is really the entry point for a child to be counted, to be recognized administratively, socially. But what we've done now with the health system is to integrate the simplified birth registration with the comprehensive electronic medical records. And this is the work we've been doing with Eric on GOTOMIS. So these are the electronic health records, the same as Aga Khan is now introducing for their systems, but in the primary healthcare facilities in Tanzania. And through integrating electronic medical records where the needs of a child is not documented in silos, one health worker that receives a child can look at whether they've been immunized, what their growth chart is like, have they been having recurrent problems, and it doesn't matter if this child has visited a health facility in another district or a different facility in the same district, the doctor can still see it. So these kinds of innovations are really, really crucial, and rallying around and improving these systems. Today we have more than 85% of our primary healthcare facilities in Tanzania connected to centralized GOTOMIS. Something interesting is happening.
Air conditioning.
Yes. And we're especially excited because this system is growing, and please come to our forum where Eric is going to tell us more on Friday, but really it covers all services and the use is increasing. So we see a lot of potential. I see the nod. My time is up.
Thank you very much. Hippolyte, you are coming from National Health Insurance, isn't it?
Sure.
Yes. So how and to what extent the digital tools has broadened health insurance coverage in Tanzania?
Thank you. It's quite a broad question, and we know we have many players, both in public and private insurers. But for NHIF, we believe this digital transformation can help us to achieve that UHC target. How? Because we have introduced the digital platform to allow members, prospective members and the corporations to enroll and to manage their insurance plan. At this time, as I said earlier, they don't need now to come to NHIF offices countrywide. They'll use the digital platforms for registration, to manage their, select their appropriate bundle insurance plan and manage it, and even pay the contribution. Again, we have done interoperability with the NIDA, National Identification Authority, and then RITA for registration of birth, marriages, where initially people were required to submit the hard copies of registration certificates and identifications, but now with this interoperability, we inquire the documents, information from the respective institution. Even the doctors now will need to verify their qualification before treating our members. So we have linkage with MCT, Medical Council of Tanganyika, where we only process the claims or pay the claims for the qualified doctors with the updated license. Again, reduce the price and the time for production of ID. We are using e-card, and we can use also the NIDA number, National Identification Number, and we are looking forward to use even the mobile number to enable patients or members to be identified at the point of service in the health facilities. So this has reduced the cost of production of IDs, which was around $5, but now we don't need to produce the physical IDs. We don't need to carry the physical IDs. You can only have your ID number or use a NIDA number, or at the point of registration, of service, use biometrics, fingerprints and facial recognition. This has brought down the cost of production of IDs, also the complaints from members who were initially concerned about the delay of issuance of membership cards. So we believe we are ready for universal health insurance because with these strategies we will enroll members conveniently. About claim processing, we have streamlined the claim processing by digitizing the claim submission, processing, and the payment, and even incorporating the artificial intelligence in claim processing. This has reduced the paperwork, human error, and ultimately reduced the aging claim payment days from over 60 days now to below 30 days. For example, currently we are processing the claims for August. So that is to say that we are ready for processing, to save a lot more members by using technology. So we believe the digital transformation can be a very good vehicle.
Thank you very much. Thank you very much. Eric Kitali, you are Director of ICT at the President Office, Regional Administration, Local Government. You have over 20 years experience working this area. So you have a lot of experience in implementation in the digital innovations, but also utilization of the data. I don't have any question to you. So this is free for you. You have heard what all your colleagues have said. Can you tell us what has not been said?
Thank you very much for the bonus. And I have few takeaways. Number one, continuous improvement. Partners and government, we have done so much in digital space, health digital space. We have reduced number of systems. You remember, we had several systems, thousands and hundreds. we reduced to very few. For instance, if you go to regional referral hospital, we have only one system across the board. If you go to primary health care, we have only one system, GoToMIS, across the board. In RRH, we have EHMIS. And GoToMIS is covered more than 86% of all the facilities. So what we are saying here, continuous improvement is key to achieve everything what we are desiring here. Because if you have anything, we have to improve what we have so that we can achieve what we desire. That's number one. Number two, we have to have single point of truth of whatever we have. It is better to have wrong data across so that if you address that particular issue, you address across. But it is worse to have different versions of information in different systems. So that is really important. So if you have any requirement or anything, it's better if we collaborate together and ensure everything is working fine. That's number two. Number three, data use. We are advocating using data from the systems which you have. For instance, you go to primary health care, if you go to tertiary, if you go to the national hospital, if we are utilizing the data, for instance, you are requesting for a particular information, for a particular data, get it from the system. That will assist us to ensure whatever we are delivering is as per requirement, as per your need. That is really key and really important. Another thing as the fourth takeaway is embracing emerging technology. They are saying AI will not replace human, but human with AI will replace human without AI. So it's really important to ensure we are adopting and we are adapting emerging technology in whatever we do. That will assist us to move forward. Last one, we have this African proverb saying, together we move far, alone you just move fast. So together, as we are all here, partners, the government, colleagues and friends, the ambassadors, together we can move the digital health in Tanzania forward. Otherwise, if we go alone, it will really, you just go fast, but you won't go far. Thank you very much, moderator.
So ladies and gentlemen, thank you very much. And once again, join me to put hands together for our panelists. I was trying to make summary, and I wanted to give time to the audience, but time is not on our side. So allow me to summarize what has come up from our panelists. They have all agreed that digital innovation and utilization of the data is very important in the implementation of the universal health coverage. And they say so because the digital data utilization, it helps to improve patient outcomes through personalized treatment. They can use their gadget patient to receive the information from their doctors, but also is enhancing efficiency by automating process. We have seen from the booth, they do have also the system, you can put medication, the system that can administer the drugs accurately. So we don't have to use the injection or to use injection to give medicine. But also it increases accessibility with the better health information, especially in the remote area, with the use of the telemedicine. So these technologies, facilities, helps also in the informed decision, because all the data that are being collected, they help in the informed decision, but also in the policy change. And the key aspect that nowadays are being used, apart from what in the past we used to have our laptops and computer and just plug in the data, but nowadays the issue about the artificial intelligence, AI, is very important, is a key aspect in the digital innovation data utilization. This drives the system for diagnosis and personalized care, but also electronic health records, very important for comprehensive patient data, but also wearable devices. Nowadays people, they wear the devices and they can just record all the data, and the doctors and also healthcare professionals, they can use those data to monitor the patient. For example, maybe their heart rate is being counted while the patient or the person is just walking. But ladies and gentlemen, we should also not forget, with all the benefit that we are talking in terms of the digital innovation, but also in the utilization of the data, it's very important to understand that there is also an issue about the data privacy. We need to make sure that the data privacy is guaranteed, but also the security of the data itself, because that's the patient information, but also the need for the skilled professional. That's why Professor Rugajo is here, and we ask him about what the academic institutions will do to enhance the digital innovation and data utilization. But also Mustafa said very clearly, the robust infrastructure to realize these benefits equitably is very, very important. So having said that, I want you once again to join me and put our hands together to really put hands together for the panelists. And I want to say thank you for your time, thank you for your contribution, and this is the end of the panel discussion. Asanteni sana.
Thank you so much. Can we please align for a group photo? Our photographer. One more time for our panelists. Let's put our hands together for the panelists. Thank you so much for a very insightful discussion. So as we continue with the coming session, I would like one more time to thank all our sponsors for making this session and the event a success. Thank you so much. Thank you very much. And in a very special way, I'm honored to welcome the Country Director of Maria Stop Tanzania, Mr. Patrick Kinemo, for a brief remarks, which will be followed up by a small video. Let's put our hands together for Mr. Patrick Kinemo, the Country Director of Maria Stops Tanzania, our main sponsor. Karibu sana.
Sorry, as we are settling, I would like the video to start, and then I'll just speak very briefly in the end. So a 4-minute video and 1 minute brief from myself. Thank you very much.
My name is Patrick Kinemo. I'm the Country Director for MSI Tanzania, formerly known as Maria Stops Tanzania. We have recently changed our name to MSI Tanzania, but our operations remain the same. MSI Tanzania is an international non-governmental organization. It's been operating in Tanzania since 1989. We are one of the largest providers of sexual reproductive services here in Tanzania. And when we say we are one of the largest, if we look at the statistics for last year, almost 25% of all clients who receive family planning services were served by MSI Tanzania staff in collaboration with the government of Tanzania. And similarly, if we look at women and men who use long-acting reversible contraceptives and permanent methods, almost 40% were served by MSI staff in collaboration with the government of Tanzania. At MSI Tanzania, we provide services using different models, channels. Currently, our largest model is the outreach services. Through this channel, we provide sexual reproductive health services in government facilities, working in close collaboration with the President's Office Office, Regional Administration and Local Government Authority, and the Ministry of Health. This channel allows to reach hard-to-reach areas, marginalized communities, ensuring that no one is left behind. But also within this channel, we operate what we call the embedded nurses model. And these embedded nurses are employees of MSI Tanzania, and they're placed within government facilities where they offer mentorship, building capacity of government providers, ensuring the sustainability of sexual reproductive health services beyond our direct involvement. Another channel is public sector strengthening. Here we support health facilities at both the local and national levels, improving access to high-quality sexual reproductive health services and strengthening the overall resilience of health systems. We also operate MSI centers and the maternity hospital and a social enterprise model. These facilities provide affordable, high-quality health care delivered by skilled specialists. Our maternity facility operates 24 hours, ensuring care is always available to those who need it. Beyond direct services, we also promote and distribute registered reproductive health products through our social marketing channel. These include Misoprosto, our brand is known as Misoclear, but also 2 brands of male condoms, LG and Flame, and we also have an emergency hormonal contraception, which is known as BK1. So this approach enables us to reach a broader demographic and ensure individuals can access diverse reproductive options tailored to their needs. Finally, we operate a toll-free contact center managed by trained agents. The center provides information, referrals, and continuity of care to both existing and potential clients, empowering men and women to make informed reproductive health choices. Karibuni sana MSI Tanzania, your health, your choice, your future.
Asante sana. So mine is going to be very brief, really to thank Tanzania Health Summit for giving us the opportunity to partner in this forum this year as well. But also important to me today is just to, it was to share what we do as Maristops, but maybe just very briefly why we do what we do. I note our partners are here, many of them. We work closely with the Ministry of Health, certainly Dr. Ahmed Makwani is here, Dr. Mzee Nasoro, but UNFPA, and many other colleagues here. Guest of honor, I would like to make a quick brief case why we do what we do. So one, health is a right, and so family planning is part of the health services. So we believe that everyone should be able to access family planning services. So within that, we also believe that it's a choice. So people have the right to choose freely without coercion. And we believe that if we educate, empower people, empower women, then families will make that informed choice. So health is a right, family planning is a right, and so people should invest in that. The other one is the health benefits. These are widely known. We know that family planning reduces maternal mortality. I think it contributes almost 40% in terms of reduction of maternal mortality. But it also improves child survival and strengthens overall family health. But we know that still more needs to be done, particularly to our colleagues living in the rural and underserved communities for them to access these services. Also, we know that family planning has economic benefits, and I think maybe these are not very much known in beyond sort of the spaces where we work in, but I think they need to be told. We know at the family level, family planning enables women to participate in economic activities at the times when they're spacing their births or maybe not having not made the decision to have children. So they're able to participate in jobs and contributing to a higher income and savings within that family. And this can support investments in education, in health, improving the quality of life at the family level. But at the national level, when you talk about economics, family planning can help shift what we call the population structure. So lowering dependency ratios and creating conditions necessary for what we call the demographic dividend. So Tanzania did a study, a modeling study in 2017, and this study showed that if we are to invest aggressively in family planning, concurrently with education, health, job creation, and good governance, by 2050 we should be able to raise our GDP. The current is around $1,000 to around $11,700 by 2055. This if we include FP. Without FP, we'll have around 9,000. So FP, if inclusion of FP can actually help us reap that dividend of around $2,300 GDP by 2055. And finally, one more argument is to do with climate resilience. We know that as families choose to use family planning, space their children, choose to have fewer children, this can help them respond to shocks and challenges caused by climate change. So in short, we are saying family planning is about rights, it's about health, it's about economic prosperity and resilience for Tanzania's future. So I welcome everyone to invest in family planning as we go forward. Thank you very much. Nashukuru.
Can we please give a great round of applause once again to MSI, our major sponsor to the Tanzania Health Summit 2025 for their keynote. Asante sana. Distinguished delegates, ladies and gentlemen, allow me now to bring onto the podium Mr. Ambassador Mark Bryan, trainer, UNFPA country office, but also the DPG health representative for his remarks. As he comes, let's give him a warm round of applause. Karibu sana. His remarks will be followed by a very brief presentation by TMHS. Karibu sana.
Asante. Special guest, Dr. C.F. Shagalange, the Permanent Secretary of the Ministry of Health. Director, Dr. Slim, representing the Permanent Secretary, Ministry of Health, Zanzibar. Dr. Omari Chilo, the President and your Board of the Tanzania Health Summit. Dr. Mazyanga Lucy Mazaba, the Director of Africa CDC. Excellencies, Ambassadors, High Commissioners present with us today, all the directors and government officials of the United Republic of Tanzania, representatives of non-state actors, fellow development partners, distinguished guests, habari za jioni. It's a great pleasure and honor to give remarks on behalf of the Development Partners Group for Health at this important event, the 12th Tanzania Health Summit 2025. We extend our deepest appreciation to the event organizers and to the government for supporting this forum and for its unwavering commitment to improving the health and well-being of all Tanzanians. Under the leadership, Tanzania has made commendable strides in strengthening its health systems, expanding access to essential services, and embracing innovation. This year's theme around harnessing data utilization and technologies to accelerate universal health coverage reflects a bold and a forward-looking agenda. It reflects Tanzania's readiness to leverage digital transformation as a catalyst for equity, efficiency, and resilience in health. As the Development Partners Group for Health, we're proud to walk alongside Tanzania in this journey. We recognize that achieving universal health coverage is not merely a technical goal, it's a moral imperative. It demands inclusive policies, sustained investment, and a shared commitment to leaving no one behind. It requires coordinated action from government, development partners, civil society, professional organizations, and the private sector. Each has a distinct and a vital role to play. The government plays a central role in setting policy direction, investing in digital infrastructure, regulating data governance, and building digitally competent health workforce. Development partners complement these efforts by providing financial and technical support, sharing global innovations, and working to strengthen accountability systems. Professional organizations are essential in maintaining clinical standards, guiding ethical integration of digital tools, and training the health workforce to adapt to new technologies. And civil society and community-based organizations ensure that digital health solutions remain inclusive, locally relevant, and responsive to the needs of vulnerable populations. Together, these actors form a powerful coalition to drive sustainable, data-driven health transformation across the country. Our special guests, to colleagues, ladies and gentlemen, Tanzania has piloted successful digital tools, from electric immunization registries to mobile health platforms, and we urge the government to continue to scale up these innovations based on rigorous evaluation and community feedback. The private sector offers agility, innovation, and investment, and we encourage the government to continue fostering public-private partnerships by creating enabling environments for responsible partnerships that align with the national health priorities. We recommend using data to drive equity and accountability. Disaggregated data can illuminate disparities and target and guide our interventions. With data, we can make the invisible visible. Special guest, ladies and gentlemen, in light of reduced donor funding, the government of Tanzania must take decisive steps to strengthen domestic health financing and ensure the sustainability of digital health initiatives. This includes increasing budget allocation for health, exploring innovative financing mechanisms such as health insurance schemes and health taxes, and fostering public-private partnerships that align commercial incentives with public health goals. By mobilizing internal resources and creating a conducive investment climate, we can reduce dependency on external aid while accelerating progress towards UHC. An encouraging example to commend is the government's introduction of the HIV response levy and allocating 70% of its proceeds to the AIDS Trust Fund, demonstrating a strong commitment to domestic finance, sustainability, and national ownership. We commend these efforts and look forward to supporting further in this regard. In line with Tanzania's health sector priorities, development partners are committed to working closely with the government to ensure strategic collaboration benefits all Tanzanians. By fostering collaboration across all stakeholders, government, development partners, professional bodies, and civil society, Tanzania will continue to build a resilient, data-driven health system that delivers quality care to every citizen. To our special guest, PS Dr. CF, as development partners, we reaffirm our collective commitment to Tanzania's health sector strategic plan 5, the digital health strategy, and together our broader sustainable development goals. We'll continue to partner in providing technical assistance, financial support, and policy dialogue to accelerate progress towards UHC. Let this summit of 2025 be a springboard for bold action. Together with government leadership, private sector innovation, and development partner solidarity, we can harness the power of data and technology to build a healthier, more equitable Tanzania. Asante sana, thank you very much.
Let's put our hands together one more time for Mark Bryan, the DPG Health Representative and UNFPA Country Representative. Can I now take this opportunity to welcome Dr. Julius Songopa, Director of Health Solutions and major sponsor of this summit from TMHS, to give few remarks. 5 minutes. Let's put our hands together for Dr. Julius. Karibu sana. And Africa CDC will follow after TMHS.
Guest of honor, distinguished guests and delegates, ladies and gentlemen, good evening. As introduced, I'm Dr. Julius Songopa, the Director of Health Solutions from TMHS, which is part of TMHS Group. And this evening, I'll be taking you through one among our services, which is project implementation services that goes hand in hand with strengthening health systems and transforming health care. So we see that most of the time we have very strong visions that at the end of the day, the execution always flatters. We come and see that we come with very good proposals, but when it comes to execution, there is always either it's failed or overdue or over budget. We have seen that there are mainly 4 gaps when it comes to implementation, which stalls the progress of the projects that we are all coming up and trying to implement in the health sector. These gaps include proposal to practice gap, whereby not necessarily planning and writing down grants is the same as managing these projects. Another gap that we have seen is the technology integration gap. Sometimes we have the technology, as the previous colleagues have said, the technology is there, but when it comes to its utilization, becomes a gap, or sometimes it becomes a burden. Another gap is the capacity and sustainability of the programs. We find that there will be expatriates, so there will be people who come in, implement the program, and when they leave, nobody is left behind who can continue with the implementation of the program. Lastly, but not least, is being able to measure the impact of our programs. So, after seeing those gaps, we come in as your partner to make sure that we bridge these gaps. And we bring in our value proposition, which starts with end-to-end project management, lead, having the local knowledge, and global standards. We come in having local knowledge of Tanzania, but we bring in global standards to make sure what we are implementing can be seen and measured, not just here in Tanzania, but globally accepted. Another proposition, we use technology as a catalyst. We have seen that among the discussions here was utilizing of the technology, but technology comes in for us as a catalyst. As one of the colleagues said, technology is merely a tool, it is how we use it. And at TMHS Health Solutions, we make sure that we use technology as a catalyst for your projects to run faster but effectively. Lastly but not least is accountability of the project and the outcomes. So I ask a question. Are we ready to bridge the gap? And if we are ready to bridge the gap, then please do partner with TMHS. I call on for all donors, social enterprises, corporates. If you want to see your projects having impact, measurable impact, please partner with TMHS. Thank you.
And TMHS is truly showing an example of partnering, because they've also partnered with Tanzania Health Summit, which is a great success as it is. Let's once again give them a big round of applause. Thank you so much, Doctor, for your presentation. Distinguished delegates, ladies and gentlemen, we are moving towards the closing of the session, but we still have an honored to bring to the podium Dr. Mazianga Lucy Mazaba, the Director for Eastern Africa Regional Coordination Center at the Africa CDC, for her remarks, to be followed by Dr. Salim Slim from Zanzibar. As she comes, probably the only female speaker we've had after the panel, let's give her a warm round of applause. Karibu sana.
Thank you very much, Director of Ceremonies. I'm kind of getting used to being one of the few women in the room. The Africa CDC has 5 regional coordinating centers, and out of the 5, I'm the only female regional director. It's a tough one. I've been in East Africa for 1 year now, 1 year a month, so 13 months. And I'm learning I'm making an effort to learn how to speak Swahili. So allow me to greet you in Swahili. Habari zenu wote. I need to be encouraged. Habari zenu wote. Asante. It's an honor really to be back in Tanzania, and specifically to this summit where we see a lot of health leaders, innovators, practitioners come together to shape the future of the health system, our health system. Having been with you at the 11th summit last year, I'm really encouraged to see the progress that has been made since then. But as I was saying to our chair, our president, I'm also reminded of a great conversation I had with a great brother who unfortunately has left us, the late Dr. Ndungulile. We had great conversations, and what came to mind as I was invited to this summit this time was how he emphasized that only through unity of purpose can we truly advance. May his soul rest in eternal peace. Indeed, since our last gathering, Tanzania has taken important steps forward. We've seen the expansion of community health worker programs, reaching more households with essential services. We've seen Tanzania strengthen its laboratory networks and surveillance systems aligned with Africa CDC's vision of early detection and indeed rapid response. We've also seen Tanzania increase domestic investments in health. We did hear about the National Health Insurance Fund, showing stronger commitment to sustainability. And we've also seen the integration of digital health tools into service delivery and indeed monitoring. Chief guest, your National Public Health Emergency Operations Center has demonstrated how data coordination transforms outbreak response, whether we're talking about Mpox, cholera, Marburg, or even COVID-19. Indeed, the efforts of the government and its agencies in strengthening the National Public Health Institute and using digital platforms for immunization and community health provides lessons for the entire continent, not just for Tanzania. And through the Eastern Africa Regional Coordinating Center, the Africa CDC is proud to work with Tanzania to build stronger systems for surveillance, laboratories, immunization, and indeed workforce development. And these are some of the steps that remind us that commitments made here do not end as discussions. They translate into actions that impact lives. When we talk about unity of purpose and partnerships, we see that progress is never the work of one actor alone. It reflects the collaboration of many. So we see the Ministry of Health of Tanzania providing leadership and vision, our development partners who continue to support digital transformation and system strengthening, the private sector and innovation bringing in fresh solutions to pertinent challenges, academia and research institutions generating evidence, and most importantly, communities and healthcare workers who ensure that progress reaches where it matters the most. This is unity of purpose to action. This year's theme, harnessing data utilization and technologies to accelerate universal health coverage, speaks directly with the Africa CDC's mission and to the aspiration of the Agenda 2063. So when we speak of data and technology, we are not speaking about an abstract concept. We're indeed speaking about tools that save lives, they protect communities, and give Africa the power to chart their own health future. At the Africa CDC, our mission is to strengthen public health institutions, foster regional collaboration, and act as Africa's public health shield. Within these missions, 5 areas are central to accelerating universal health coverage through data and technology. We talk about stronger data and surveillance systems, and the 717 approach, helping countries detect, notify, and indeed respond to outbreaks. We talk about harnessing genomics and laboratory surveillance, expanding sequencing capacity in over 40 countries on the continent, and tracking diseases without relying on labs abroad. We're talking about scaling digital health, supporting member states to roll out electronic health records, immunization registries, and it was exciting to hear that conversation here. And indeed investing into people, training epidemiologists, data scientists, and leaders through the Kofi Annan program and the field epidemiology training, much of which Tanzania is a part. Lastly but not the least, promoting equity and self-reliance, guided by the new public health order, including the goal of producing 60% of Africa's vaccines locally by 2040. I hope, peers, we are together on this agenda to ensure that we are able to secure commodities for our people. As I come to my conclusion, allow me to give a call to action. First things first, as I look into this room, I feel hope. I see leaders, innovators, and indeed young professionals, especially in the exhibition places, who believe that Africa's health, the future of Africa's health can and must be different. So if we harness our data wisely, ladies and gentlemen, if we embrace technology fully, and put people at the center of every decision, we will achieve universal health coverage, and not as a distant dream, but a shared reality. So, ladies and gentlemen, on behalf of the Africa CDC, our Director General, Dr. Jean Kaseya, and indeed on my own behalf, I wish this 12th Tanzania Health Summit successful deliberations and practical outcomes that will make a difference for every Tanzanian and indeed every African and the world. Asanteni sana na Mungu awabariki.
Thank you so much, Dr. Mazianga from Africa CDC. Let's put our hands together one more time for Dr. Mazianga. I'm now honored and delighted to welcome Dr. Salim Slim, on behalf of the Principal Secretary, Minister of Health, Zanzibar, to say a few remarks. This will be followed up by a few remarks from our chief guest. Karibu sana.
Honorable Chief Guest, the Principal Secretary, Minister of Health, Tanzania, dear colleague, protocol observe, good afternoon. It is an honor to stand here for my Permanent Secretary, on behalf of my Permanent Secretary and the Minister of Health Zanzibar, to really convey our gratitude to partner and everyone who is here today for the amazing milestone that we have achieved in our ministry in digitalization or digital ecosystem. We're all aware, as a few presenters who came here, they really declare that digital ecosystem is a new health infrastructure, which means nothing can easily be achieved if digital ecosystem is not fully embraced. In Zanzibar, government priority is actually looking at the whole health system building blocks. But if you look at health system building block, digital ecosystem is more like an engineer that actually cascades the efficiency and effectiveness of service delivery in all of this health system building block. So in relation to strengthening primary health care, this is one of our paramount agenda, but also reducing out-pocket expenditure, but also patient empowerment is also improved through digital ecosystem, we further on blockchain and reduction of duplication. Furthermore, we really put forward the important use of evidence in this decision making, and therefore technology or digital ecosystem has really helped us to cascade our way of delivering care using such platform. I really stand here on behalf of my permanent secretary, but as a director of preventive service, I urge all the partners to continue to support the Zanzibar Ministry of Health, but also investing heavily in our primary health care, because we really wish to cut down the rate of curative bills that currently seems to have gone beyond control. We want to thank our President, Dr. Hussein Mwinyi, for his effort in making sure health become part of his top agenda. But also I want to put my thanks for our President of Tanzania, President Samia Suluhu, for cascading and making sure no Tanzanian is left behind. I think without further ado, I should rather leave it to my brother Sheikh Elage to come here and probably provide more detail. But we really thank you for helping us closing gaps. The milestone we have achieved today in Zanzibar has hugely contributed because of the support and collaboration that we have had, and please continue to do so to make sure that we are building a human capital which is better for economic empowerment of our country, and that's where sustainability can merge. Thank you very much.
Good evening. Can I kindly ask you to stand up? Whatever you want to do, just stretch out your body. Thank you very much. You may be seated. I know you have been sitting for the last 2 hours or 3, sir. It has been a long day, but I want to promise you, this is the last remarks that I'm giving. After that, I think we have only one activity, and then we call it a day. I want to ask you also to bear with me in the next few minutes, so I give remarks on behalf of the government of Tanzania. Ladies and gentlemen, the chairman of the board, members of the directors, distinguished guests. First of all, I know when I came in here and when we were about to start, there was a national anthem that was, uliimbwa. So normally such a song, as per protocol, we do expect to the high level of the government officials. So I would like to dedicate that song to our beloved nation. But also dedicate that song to all of us. But also dedicate that song to the peace of this nation, especially during this time of election. So that's what I meant about the national anthem. It was expected to have high officials here. That's why we can have a national anthem. But for some of us who are on the technical, we normally just proceed as usual. So my great honor to join you at this 12th Tanzania Health Summit. First and foremost, I wish to extend heartfelt thanks to the summit leadership and team for their tireless work and the excellent organization of this summit. Your commitment and professionalism have once again provided us with a platform to engage in a critical discussion on health. On behalf of the government of Tanzania, thank you for bringing us together to advance our national health agenda. We are gathered here as a community of health sectors and stakeholders, from policymakers, healthcare professionals, development partners, and innovators. This diversity under one roof is exactly what makes the Tanzania Health Summit such a powerful forum. Thanks again to the Board of Directors for their strategic guidance, the organizing committee for organizing this event, but the steering committee for ensuring we remain on course, and the entire Tanzania Health Summit for the groundwork behind the scene. You have all contributed immensely to making this summit success. Ladies and gentlemen, the Tanzania Health Summit has grown to become more than just an annual conference. It is now a strategic partner to the government in our collective mission to improve healthcare for all Tanzanians. Year after year, the summit provides a dynamic forum for advancing knowledge, research, and innovation in health. This all aim to complement the government efforts. As the strategic discussion feeds directly into our national health plans and policies. Ladies and gentlemen, this year's summit theme, harnessing data utilization technology to accelerate universal health coverage. It is both timely and aligned with our national vision. Digital data and innovative technology are no longer luxuries in healthcare, as we have heard during the panel discussion. In Tanzania, we fully embrace this principle. Our government has been investing in data system and innovative technologies to transform healthcare delivery and bring us closer to the universal health coverage. We have made tremendous progress in leveraging data and innovation to simplify healthcare delivery. For the first time in our country history, we now have an integrated electronic medical record system that links patient information from the community level dispensary all the way to the health centers at the district level up to the national level. This is a huge achievement. Ladies and gentlemen, allow me to highlight just a few flagship programs and innovations that demonstrate how data and technology are improving healthcare in Tanzania. The Mama, the founder of this, our beloved Dr. Samia Suluhu Hassan, the President of Tanzania. This is one of our proudest innovations she has made. A digital platform that coordinates emergency transport for pregnant mothers and newborn in distress. Through a simple toll-free number and a mobile app, healthcare workers can call for help, and the local community drivers or ambulance are dispatched via GPS as the official national maternal emergency transport system, EMMAMA, now saves all Tanzanian and is projected to transport over 50,000 women and newborns. And this has saved many women's lives and the children. And this EMMAMA is now even thought to cross the border and be applied in other nearby countries. Jamii ni Afya Digital Community Health Program. This is in Zanzibar. We have a groundbreaking program called Jamii ni Afya Community Health, which is the world's first government-led digital community health system, a full national scale. Through this initiative, every household across all districts in Zanzibar is now connected to a community health volunteer equipped with a smartphone. This is also another huge achievement in our country. We are also piloting telemedicine services in partnership with stakeholders, where specialists in urban centers provide remote consultation to patients or doctors in rural clinics via video and mobile apps. These efforts in telehealth are breaking down geographic barriers and ensuring that even remote communities can benefit from the expertise of our top medical professionals in the country. Ladies and gentlemen, Tanzania is fully committed to the global goal of achieving universal health coverage. This means ensuring that everyone, everywhere, can access the quality health services they need without suffering financial hardship. Everyone should have an equal opportunity to access health care regardless of the financial hardship. We want the people of our country to be among those benefiting, and we are working diligently to contribute to the worldwide effort. Distinguished participants, the government of Tanzania wants to send a clear message today that we are fully committed to sustaining and expanding the gains in the digital health and data utilization. You cannot do alone, we can do together. And that's why we have invited all the partners, all stakeholders to work together with us to achieve this dream. We also want to send a message that we promise our stakeholders, including private sector, technical companies, development partners, but also researchers and health workers, that we will continue to work hand in hand in this journey in the implementation of universal health coverage. Third, the Ministry of Health is already developing the next digital health strategy from 2025-2030, building on the achievement of the last strategy. This is all to make sure that we embrace digital innovation and technology in order to improve the lives of Tanzanians, but also smooth implementation of universal health coverage. We will be looking to incorporate emerging technologies like artificial intelligence, but also machine learning in health. We also strengthening cybersecurity and data privacy for our health information systems. In all these efforts, we greatly value the support of our partners, whether it is through technical assistance, innovative financing, or on-the-ground project implementation. Your contribution help turn ambition plans into real improvement to the service delivery in our country. We will continue to expand training for healthcare workers in the digital literacy, that the human capacity keeps pace with the technology advances. We will also strengthen multi-sectoral collaboration, since achieving digital universal health coverage involves sectors like telecommunication, finance, and education. To our beloved development partners who are here, and the private sectors, we hear your calls for consistency and scale, and we pledge to integrate pilot innovations into the national system when they prove successful. Before I conclude, I want to emphasize the importance of this forum, the Tanzania Health Summit, in our collective journey. This summit is not just an annual conference. It has become Tanzania's premier health platform, a place of ideas. I repeat, this summit is not just an annual conference. It has become Tanzania's premier health platform, a place of ideas, partnership, and accountability. I urge all partners, donors, stakeholders here today to continue supporting Tanzania Health Summit in every way possible you can. By supporting, participating, implementing the ideas generated here, you help keep this platform strong and impactful to the communities. We ask that you not only come back next year, but also champion the summit's resolution with your own organization, and please bring other partners to join the next summit. Let us ensure that energy and insight from these discussions translate into concrete actions and complement government efforts. But just my message to the summit organizers, as I have heard when the president was giving his remarks, he did mention that every year there are recommendations that we bring after the end of the summit. What I did not hear, and how did we fare well in the previous recommendation here? So I urge you next time, please tell us, analyze and make an evaluation of the recommendation that we have made. Where did we do well and where we didn't achieve anything? That will help the members who are here next time to make sure that the recommendations are made here, they are implemented for the success of our people. In a special way, I want now to conclude, and I want to iterate the optimism I feel. Tanzania is on the move towards healthier future through universal health coverage. A future where no mother dies giving life. A future where no child is denied of care. And no patient is impoverished to the medical bills, regardless of the financial hardship. The government will continue to provide the political will, resources, and enabling policy and environment to achieve our shared objective. Having said that, in a special way, I wanted to thank each one of you for coming, for participating, for contributing to make this summit success, especially to our partners. Once again, thank you for your attention, na asanteni sana, Mungu awabariki. Thank you very much.
Another big round of applause to our special guest this evening. Thank you very much, our Permanent Secretary, Ministry of Health, for your remarks. May I please request those who had the honor and pleasure to give their remarks, starting with the Principal Secretary from the Ministry of Health, Zanzibar, Dr. Chilo. Can I bring you back to the stage? Can I ask you, Mama Zianga? I only remember Yanga. Please join me on the stage. Mark, Ambassador, karibu sana. We are now going to recognize a couple of people who've done extremely well in the year 2024, 2025, starting with, can I also have the usher who is responsible for the prizes? Yes, let's please line up. If you can move slightly to the center of the stage. Board Chairman, karibu sana. Join us onto the stage. May I call upon the sponsors. First and foremost, we shall recognize all our sponsors. Can I bring to the stage, do we have a representative from Abbott Fund? Abbott Fund? Abbott Fund, they are not here. Sanku? Do we have representative from Sanku? Interest of time, I will only be calling twice. Girl Effect? Girl Effect, if you're coming, please wave at me. Girl Effect? They're not here. Mary Stops. As he comes, let's put our hands together for him. May I request TMHS to prepare for the next award. Number background music, technical team. Where's the one? TMHS, number tusogee karibu. TMHS, if you can come closer. Once again, a big round of applause to MSI. Thank you so much. Let's exit through that side to Shukie Pandewule, yes. Can I now call onto the stage TMHS, who are platinum sponsors and part of the organizing institution, please. Ongeza tu sauti. Nitaomba brass band baada ya tuzo inayofuata tuzipokee, tuende kwenye kategori nyingine. Let's put our hands together for TMHS. Asante sana. Guest of honor Sanku is on the stage. So let's also recognize the contribution and support by Sanku. A round of applause to our sponsor Sanku. I would also like to thank you very much brass band. Naomba tuzipokee hizo zote kwa ujumla.
We are now going to give a certificate of recognition to Dr. Ansbeth Rugakingira. Let's put our hands together for Dr. Ansbeth Rugakingira. Let's put our hands together again for Dr. Ansbeth, who was among the organized committee members, but now he is retired, I think.
Hongera sana Dr. Ansbeth Rugakingira. He was since 2021 member of the organizing committee, but is now moved on. He's gotten a big post ahead of him, so congratulations and thank you for all your support. Distinguished delegates, ladies and gentlemen, we are now going to recognize the healthcare workers of the year. To begin with, the District Medical Officer of the Year. This is none other but Dr. Saum Saif Kumbisaga. As he comes, let's put our hands together for him. For her, apologies, Dr. Saum, karibu sana. So for those of us, we ought to know that this award goes to Dr. Saum Saif Kumbisaga, District Medical Officer from Kiela DC. C Mbeya for outstanding leadership in strengthening health system in disaster-prone areas, advancing WASH initiatives, expanding outreach in flood-affected communities, and improving maternal care through resilient quality healthcare delivery. Naomba tumpigie tena makofi. Asante sana. Next onto the stage is the Nurse of the Year. The Nurse of the Year award goes to Tumaini Ikumbio Matatu. So this award goes to Tumaini Ikumbio Matatu, specialist midwife at Benjamin Kappa Hospital, for outstanding leadership in maternal health, managing high-risk pregnancies, innovating patient education, and mentoring future nurses, significantly improving maternal and newborn outcomes in Tanzania's Central Zone. Makofi mengi to the Nurse of the Year, Tumaini Ikumbio Tatu. We also appreciate us shaping national guidelines and advancing quality diagnostics that strengthen early warning policies and life-saving actions in Tanzania. Hongera sana daktari. We now bring two people from Zanzibar in the category of Zanzibar Healthcare Workers of the Year. The awards go to Mwana Ali Haji Ali and also Dr. Lwayumba Joram Regasila. Please come onto the stage. As they come, I wish to recognize the award that goes to Mwana Ali Haji Ali, RIMNCH Program Manager at Milele Zanzibar Foundation, for transformative leadership in maternal and child health, developing Zanzibar's first quality improvement standards, pioneering the Mnazi Makini mobile app, and mentoring providers to deliver safe, equitable, and evidence-based care. Once again, naomba tumpigie makofi Mwana Ali Haji Ali. They will also be awarded monetary awards, so congratulations to them. I would also like to call onto the stage Dr. Lwayumba Joram Regasila, medical doctor in charge at Ejitimai District Hospital, for his outstanding leadership in transforming healthcare delivery, establishing ICUs, reducing referrals and waiting times, and implementing data-driven patient-centered systems that set a new standard in Zanzibar's hospital. A round of applause to him as well. Distinguished delegates, I would like now to call the medical officer in charge of the year. This award goes to Dr. Hussein Zuberi Ngaila. Dr. Hussein is coming. The award goes to Dr. Hussein, the medical officer in charge at Nyasa Cancer Hospital, for his transformative leadership in maternal and newborn health, establishing a life-saving newborn care unit, introducing innovative risk pregnancy tracking tools, and spearheading major hospital projects that have expanded access to quality, affordable health care in Ruvuma region. Another round of applause to him. Distinguished delegates, I wish to call on to the Dentist of the Year. The Dentist of the Year award goes to Dr. Arnold Othman Mahega. So this award to Dr. Arnold is a dental surgeon at Ihsan Turkish Dental Clinic, for his outstanding dedication to patient-centered care, treating over 500 patients with near-effect completion, reducing waiting times, and fostering professional growth through peer training, advancing excellence in oral health. Dr. Arnold Othman Mahega, a round of applause to him. Distinguished delegates, I wish to call onto the stage Public Health Officer of the Year. Public Health Officer Award of the Year goes to Miriam Adam Mongi. Miriam Adam Mongi, there she comes. She's an Environmental Health Officer at Ubungo Municipal Council for a groundbreaking placenta to biogas innovation, transforming medical waste into renewable energy, reducing costs and emissions, and advancing sustainable green healthcare solutions. Public Health Officer of the Year, Miriam Adam Mongi. A round of applause. Ladies and gentlemen, we have the Community Health Worker of the Year. Community Health Worker of the Year award goes to Nelson Francisco Edward. As he comes, this award goes to him as a volunteer community health worker in Kerwa District for his extraordinary dedication in reaching remote mountain villages with life-saving vaccines, maternal care, and health education, bridging language barriers, reducing stigma, and transforming community health through grassroots leadership. Community Health Worker of the Year, Nelson Francisco Edward. Ladies and gentlemen, the chairman of Tanzania Health Service has extended a monetary prize of 1 million shillings to Nelson Francisco Edward as a Community Health Worker of the Year. 1 million award goes to him. Ladies and gentlemen, I couldn't have the very best co-host to this event who has also emerged as the Pharmacist of the Year, Mary Patrick Sima. She is the Pharmacist of the Year and Vice President of the Pharmaceutical Society of Tanzania for exceptional leadership in strengthening the pharmaceutical workforce, ensuring access to essential medicines, advancing antimicrobial stewardship, and mentoring professionals to drive innovation and policy impact in Tanzania. The Pharmacist of the Year 2025, Mary Patrick Kisima. I am honored to bring the Medical Laboratory Scientist of the Year. This is none other but Goodluck Eliakim Wanga. This award goes to Goodluck Eliakim Wanga, Laboratory Scientist and Epidemiologist, for his pioneering role in establishing laboratory-based surveillance system, shaping national guidelines, and advancing quality diagnostics that strengthen early warning policy and life-saving actions in Tanzania. Distinguished guest, the Medical Laboratory Scientist of the Year, Goodluck Eliakim Wanga. A round of applause. Basment, naomba tuzipokee hizo. We are now going on to the last but one category of awards, and these are known by the name Ntuli Leadership of the Year Awards. We'll have a video, so I will request the guests to kindly look at the video that is going to be on the display, and then as Dr. Ntuli could not make it in person, and thereafter we'll call the 3 winners of the Ntuli Leadership of the Year Awards.
The primary healthcare award are actually emanated from number of lessons that have been learned from Tanzania and some other countries, that those countries which have invested in primary healthcare, they have been able to improve the health outcome and well-being of their people. Investing in primary health care has a high return on investment, and therefore it is a duty of government, duty of both multilateral and bilateral stakeholders, development partners, to be able to invest into the primary health care. And that's the essence why I thought I should establish this one, because it's going to sensitize and it's going to recognize the contributions of the people who are behind our healthcare system. To my friends, the nominees and the winners of the Utilization Primary Healthcare Award, I want to give you a message of encouragement. This is well done. However, this is going to be a very long journey. A journey of being exemplars in delivering of primary health care. So let us make this one of a movement, and not just of today's moment. A movement that requires us all to be able to push the primary health care agenda going forward. There are so many things are happening around the globe that in one way or the other might be affecting primary health care. I expect you to be champions. I expect you to stand up in primary health care. And I expect you to work with other champions around the globe to frontier the primary health care agenda. Hello everyone, my name is...
And in Tuli Awards, we have 3 categories. Category 1 is in Tuli Leadership of the Year, and this goes to Innocent Kasmir. Innocent Mahagama is a district medical officer of Utigwe district for his transformative leadership primary health care, achieving full autonomous rollouts, improving vaccination and maternal health outcomes, strengthening cross-border disease surveillance, and building resilient people-centered health systems. One more time for Innocent. The second category is in Tuli Implementer of the Year. Congratulations, Innocent. The next one is in Tuli Implementer of the Year, and this goes to Roman Living Minja. As he comes, Roman is a registered nurse at Nyerere dispensary for his exceptional dedication to underserved communities, improving maternal and child health, expanding youth access to reproductive services, and achieving full vaccination coverage through cultural sensitive, community-centered care. Congratulations, Roman. Let's put our hands together for Roman. The third one is Ntuli Researcher of the Year, and this goes to Johans Masatu Malija. As he comes, Johans is a district epidemiologist and a research and global health coordinator at Muheza District Council for his outstanding contribution in public health, leading outbreak responses, advancing research, and implementing evidence-based interventions that improve reproductive, child, and infectious disease outcomes. Let's put our hands together for Johans. Congratulations, Johans.
And the final recognition will now be going to the organizing institution, and then we shall award the president. To begin with, CSSC. Please come and receive your award. CSSC. Okay, I would like to call BAKWATA. BAKWATA, as they come, let's give them a round of applause. May I request the representative from PRLG to please come on to the next recognition. Asante BAKWATA, thank you so much for your support as one of the organizing institutions of the THS 2025. Asante BAKWATA. Can I now call to the stage PRLG, President's Office, Regional Administration and Local Governments. APHFTA, are you here? APHFTA, if they are not here, oh, they're here. Karib sana. AFTA. A round of applause to AFTA. Thank you so much for your support. Hizi tuzo mbili zinazofuata ni kuombe mwenyekiti wa board. May I request the board chairman to present the next two awards. The first one goes to Ministry of Health Zanzibar. Nomba utampa. KM, nomba mwenyekiti akabidhi hiyo kwa Wizara ya Afya Zanzibar, Ministry of Health Zanzibar. Asante sana. Nimefanya hivyo PS kwa sababu inayofuata ni ya kwako. Kwa niaba ya Wizara ya Afya Tanzania, naomba the next one to the Ministry of Health Tanzania. Sawa. Tunamaliza, ya mwisho utaipokea wewe pia. A round of applause to Ministry of Health Tanzania. Distinguished guests, ladies and gentlemen, and the final award for the day and for the year goes to Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania. The chairman will present that and will be received by the Permanent Secretary, Ministry of Health. Mwenyekiti, naomba ikabidhi hiyo. May I call onto the stage all the awardees. If you know you've received an award today, please come onto the stage for a group photo. All the awardees, please come to the stage. Wote tuliopokea tuzo, may I call to the stage all of those who received the awards today. Please come onto the stage for a group photo to be followed by all the sponsors, and those who will be it. We'll be calling an event to the end. The guest of honor, our special guest, has to leave. Niombe all the awardees tuliopokea tuzo tushangamke kidogo. Time is of great essence. Mabalozi, please prepare. Let's go on the other side as well. Let's move, let's move, let's move. All the awardees, please. Asante, wapige picha, naomba muandae hiyo. May I call onto the stage balozis, all the ambassadors present, our keynote speakers, our panelists, to please join onto the stage. Distinguished guests, members of the board, please come onto the stage. Asante awardees, let's exit through our left-hand side. Tayari. Kapo. Thank you, awardees. May I now call all the ambassadors, panelists, distinguished guests, foreign delegates, development partners who are present with us as of this point to please come onto the stage. Can we move slightly to the left? Kindly let's move slightly to the left. So thank you very much. May I request all of us to kindly stand up. Can we all please rise as we allow our special guests to take leave. Brass band, tunaomba mtuongoze wakati viongozi wetu wanatoka. Thank you so much. Msaidizi wa katibu mkuu na kuomba hapa.
Nataka mpe balozi business card yake. Naichukua.
A long event. You're always welcome. I don't do visas. So that's not my business. So it's in Kenya. We do it in Kenya. You have to talk to Italy if you want to go. Yeah.
Thank you.
Brass band. Tutaendelea na wimbo brass band, lakini nimekumbushwa kuwashukuru wote. I would like in a very special way to thank you all for your patience, for being able to stay with us up until this time. Thank you all. Thank you very much. Brass band tuendelee.
Well done.
Niroge kwa mama. Nataka nimekewa.